Hey, I'm Dr. Brian McKay of Core Health and Darien, and today I want to talk to you about the role of chiropractic care in managing soft tissue injuries. Now, a lot of times people think of soft tissue injury as just a muscle. I need to tell you there could be a bone involved, a ligament involved, a nerve, muscle. So there's a lot that goes into soft tissue injury. So to begin with, let's address stage one of a soft tissue injury and how a chiropractor can help with stage one, which we call active swelling. Active swelling occurs for 12 to 72 hours after an injury. In this phase of care, motion is lost and pain is increased. The goal of chiropractic care in stage one is to minimize the pain and the swelling. And how we go about doing that as chiropractors is we treat it with rest and we support the injured area. So if you got a bad knee, you're going to rest the knee, raise it, you're going to put ice on it. And what that's going to do is we're going to block the swelling, the pain, and minimize the spasm. Now, stage two of a soft tissue injury, we call that passive congestion. And now in stage two, as a chiropractic patient, we would treat this with, to remove the fluid. We want pain relief, and we want to begin to restore the motion. Now, in doing so, we use what's called a chiropractic adjustment. And what the chiropractic adjustment is going to do is going to help get the fluid that's trapped in the tissue that's restricting the motion, causing the pain, and we want to get that fluid to move out of the congested area. So the tissue becomes congested. I think it makes sense. As you have swelling, you're going to have congestion. Now, to get the fluid out to start the next phase of care is important. But how the chiropractic adjustment, which is the treatment chiropractors use primarily, is it's going to help the issue, the stage two passive congestion, by restoring the motion, blocking the pain, restore normal nerve sensation, which is really important because the brain is going to be aware of this body part being affected. Now, how do we reverse out of that? It's going to help relax the tight muscles. It's going to help with the swelling. It's going to accelerate the healing, and we're going to remove that fluid. We do it with the chiropractic adjustment, but also to some specific control motion exercises and some physical therapy. Now, at Core Health and Darien, we have the luxury of having a physical therapist on staff, and doing so, we use chiropractic care, physical therapy, and at times massage therapy to speed the healing. The tissue injury causes restriction of motion due to inflammation, pain, swelling, and muscle spasm. So in stage two, the goal of the care, of chiropractic care, is to relieve the pain, promote healing, restore and maintain full function, reduce the likelihood of re-injury, and prevent accelerated degeneration. Now, it's very important to realize that chiropractic care should continue throughout the repair stage. It takes longer for tissues to heal and normal function to be restored than it takes for pain relief. Pain relief is the goal of you as the patient, but it's not only our goal, okay? And in this stage two, chiropractic is going to help restore normal function, motion, and more importantly, proper spinal biomechanics. It's also going to help improve the alignment of the connective tissue that forms, you would think of as scar tissues, we would call it adhesions. This is the body's way of addressing the lack of tissue support in that area. So the adjustment continue is going to prevent shortening of the scar tissue and chronic stiffness. It's going to restore and maintain flexibility of the ligaments and the muscles. The ligaments and the muscles are an important part, and most people mistake the muscles being, I have a muscle pain. Well, it's not just a muscle pain. It's one of the other several components mentioned. Is it a disc? Is it a nerve? Is it a ligament? Is it a bone? Is it a muscle? All of those things can contribute to the soft tissue injury and needs to be addressed through chiropractic care. So we also want to promote quicker and more effective healing. And again, we definitely want to reduce the risk of re-injury and degeneration. Now, stage three starts about 5 days after an injury. And this can last anywhere from 5 days to 6 weeks. And we really want to address the lack of motion, okay? The lack of motion causes excess scar tissue and dense patterns disrupting normal function. And this causes excessive scarring, more scar tissue, more stiffness, limited range of motion, poor biomechanics, chronic pain, weak muscles and ligaments, loss of normal sensation, poor nutrition, increased risk of injury, and accelerated degeneration. If motion is restored and maintained, tissues will heal in a much more functional way. So the goal in stage 3 is to repair by restoring normal motion, sensation, promote full healing, and relieve your pain. Step 4 is one of the ones that's probably the most important and often overlooked. And stage 4, we remodel the tissue, okay? The tissue surrounding it. We wanted that thing to heal, not, we wanted to heal in an optimal location, and here's why. Chiropractic treatment during stage 4 will definitely help to improve and maintain motion and flexibility. It would also reduce the chance of chronic pain and reduce the risk of re-injury and degeneration. During the remodeling phase of your chiropractic treatment plan, the connective tissue can take anywhere from 3 to 14 weeks, but can also last up to a year after a severe injury. So chiropractors use what's called a chiropractic adjustment, which are controlled forces to address where the restrictions around the joint are that they're basically unable, the bone's unable to move itself. So you have an abnormal location. And think of it this way, the body has to work harder to maintain that. And the barriers to the chiropractic adjustment are muscle spasm, swelling, edema, scar tissue, and pain. So the chiropractic adjustment identifies the restricted joints and whether or not that's painful, because at this point in time, we're 3 to 14 weeks out after the injury. So the chiropractic adjustment is not going to be addressing your pain at this point. It's going to really be addressing the spinal biomechanics. So the adjustment specifically applied to joints can restore motion when the body cannot do it on its own. The chiropractic adjustment also helps relieve pain and restore and maintain normal movement, normal biomechanics, and function. Now, the control force of the chiropractic adjustment safely generates enough energy to overcome the restrictions to take a joint back to its normal full range of motion. So I think it's pretty important for you to understand how the adjustment works. The adjustment takes pressure off by realigning, putting something back in its proper place. And putting a spinal vertebra back in its proper place will allow the body to heal faster. And again, we put less scar tissue and everything else. But the spinal biomechanics need to be restored in order to prevent a re-injury or advanced degeneration. So think about chiropractic as a way of restoring function. Using chiropractic care, you get the ability to perform everyday type of activities, loading groceries, golfing, jogging, being on your Peloton. Improved function is also the key to long-term pain relief. Failure to restore function means any pain relief is only temporary and increase the risk of chronic pain. Joints that have good function are not painful. The joints that are in the right spot perform better and are less likely to be injured or degenerate. Decrease in function can lead to injury and pain, as we well know. Chiropractic helps minimize pain and maximize functions by the use of chiropractic adjustment, specific exercise, and certain aspects of physical therapy. So the benefits and goals of chiropractic care. As a chiropractor, we strive to be safe, comfortable, and effective for our patients. So the benefits not only include pain relief, tissue healing, and good function. It does take time to get to achieve these goals. It's not something that happens overnight. There is no non-steroidal anti-inflammatory that's going to do that for you. It will only take you through, basically, if you're lucky, stage 1 and stage 2 partially. That's why a chiropractic treatment plan is usually broken down into 4 different stages. So it's important to realize that pain relief doesn't mean tissues have healed or that their functioning is restored. It takes time. And the chiropractor's job is to monitor your pain, your tissue healing, and function using specific outcome measures to know when a patient has achieved maximum benefit and it's time to end care or switch on to a wellness-based program. I'm Dr. Brian McKay of Core Health in Darien. Look forward to helping you. Thank you very much. Have a great day.